I'm very excited to see this project, which has been talked about at meetings for years, to come together and create an opportunity to, in addition to all of the clinical information that AMDA and now PALTmed have been providing to post-acute long-term care clinicians, is to have a track where the efforts of people like Todd Paithcote and others come together to share some of the business realities behind post-acute long-term care medicine and some of the impact that different forces are bringing, such as the impact of venture capital investment in this space and the impact of changing CMS regulations, et cetera. Very important area that has often been overlooked in, not just in post-acute long-term care, but in healthcare in general. Again, the opportunity has come about because of the changing in technology and the evolution of our organization, but the information itself is also a critical part of healthcare, and it's impacting not the practice of medicine, the way clinicians and patients interact, but it is affecting most of the areas around that. And so now is a great time for the organization to be able to share this information with its membership. From a business person, my answer is probably unusual. I think the patients will ultimately benefit the most from understanding how, from having their clinicians and others understand how business factors impact the way medicine is practiced and the way care is delivered in nursing homes and assisted living facilities and across the continuum of senior living centers. I'm particularly looking forward to having the group of individuals that are on the agenda to come together and present. In the past with AMDA and now PALTmed, there were 2 or 3 figures that were basically relied on to provide business information. And as the organization continues to evolve and grow, we need to plant the seeds of business knowledge in all of the membership so that everyone can come together and think through what is the impact of business, what do we need to take into consideration, both good and bad, and how can we incorporate that into ultimately providing the best patient care possible. Just like to say that the organization, PALTmed, is a great resource, and it's something that we need to continue to develop and see grow into a resource for clinicians practicing in this space. Our clinicians in post-acute long-term care medicine are taking care of these sickest patients on a long-term basis in the industry, and we need to think about how can we not just do a good job today, but how can we plan to do a good job in the future.